This Friday, at our Board of Trustees meeting, I will recognize our Dance Blue effort. That is a student-led philanthropic endeavor that raises $5.1 million a year. It's done this over the past 8 years. It grows every year so that we can better treat at the University of Kentucky those children and families who suffer the dread of cancer. So now we're adding another achievement through another partnership that brings people together. I want to salute UK healthcare leader Dr. Mike Karff and Mark Randall, who is with us today. Dr. Randall has been instrumental in this effort to announce a project whereby we're going to lease space in the former Dillards at Turfland Mall to consolidate and relocate a variety of clinical care services. Our high-quality services that will relocate there include family and community medicine, UK orthopedics and sports medicine, and the occupational medicine and environmental health clinics. This service to community, in community, where they live, I think is a giant step forward, and it wouldn't be possible without the leadership of Dr. Karff and Dr. Randall. This Turfland Mall area has been a focus for redevelopment and revitalization, and I think today is going to be a kickstart in that effort. We'll have 85,000 square feet of UK healthcare clinics in that space. It's an exciting day for the University of Kentucky. I think it's an exciting day for Lexington. We bring together these two strong brands, but the most important excitement is for the patients we serve, and that's why we're here.
The redevelopment of the former Turfland Mall space with UK Healthcare as the anchor tenant mirrors similar redevelopments of urban malls in other locations, and we anticipate that we will have the same success. And that success will be good for Lexington, for Fayette County, for UK Healthcare, and especially for the patients that we serve. As President Capelouto said, two major service lines will occupy the first floor of the former Dillard's building. First, the Department of Family and Community Medicine, led by Dr. Kevin Pierce, who's here this morning, will move essentially all their operations to this space, including all their outpatient clinical activities. The Turfland Mall location provides the ability for UK Healthcare to improve its primary care access, and it provides their patients a state-of-the-art facility with great accessibility and also excellent, convenient, and free parking next to the building. Our sports medicine, physical therapy, and rehabilitation services, led by Dr. Darren Johnson, will mostly consolidate at this location. The tremendous accessibility with all the services on the first floor, coupled with convenient parking, will provide a stellar location for these destination services. Our goal is to have this relocation completed by November 1st of this year, and at that time, I'll look forward to welcoming you back to what will be a fantastic facility in a great part of town. Thank you.
Daniel Patrick Moynihan, the late senator from New York, who was once asked, "Senator, what does it take to create a great city?" And he didn't miss a beat. He said, "Start a great university and wait about 200 years." Well, we are now, since the University of Kentucky was created and established in 1865, we are now 150 years almost on that path, and today represents another inflection point in that pathway, in that trajectory. And you know, you would think that, well, to some this may say, well, yes, it's important, but what is it about it? Well, as Mark was saying, about the urban renewal qualities of a project like this. You know, Ron, you're having the imagination to see opportunity in this space. And Dr. Capelouto, with a smile, he said, you know, I sort of think of it as suburban renewal. You know, and that was really a wonderful way to think about it. I often think about in terms of the dynamics of building the city. I admittedly full confession, full disclosure, I think of quality of place, which leads then to quality of life. And our neighborhoods that have been built in this city in the last 50, 60, 70 years. Lexington has been a city on a high growth pattern. In fact, if we compare 80, 90 years ago in 1930s, Louisville's population was about 300,000. And Lexington's population was about 30,000. Today, Louisville is double that, and Lexington is almost 10 times that. So in this course of history, our developments, our neighborhoods have grown. And around those neighborhoods grew commercial developments. And we have seen some of those decline. And today we see adaptive reuse in this suburban development in a really remarkable way. And and it's also a tribute to the imagination and the inventiveness of this university again. Mark was just describing, Dr. Randall was just describing, that they used benchmarks. They saw this model in other places, at Vanderbilt, in Huntsville, and they saw then an opportunity. Well, that represents so much of the imaginative thinking of this institution. So as a city, we are really blessed. I pinch myself sometimes and have to remind myself of that we're blessed as a university city, not a university town, because we do have a diversified economy here, and it is a vigorous one, and it is amplified by all the talent and the imagination and the inventiveness right here at this university.